Well, the holidays in many hot zones around this country are looking bleaker. Ontario hit another terrible record today with 2,432 COVID cases. Did the provincial government do everything it can to keep the virus contained this holiday season? Is it time maybe for an expanded Christmas lockdown? Let's bring in Mississauga Mayor Bonnie Crombie. She joins us now. Good to see you, Mayor. There are more cases again, a record number, and the Ontario Hospital Association is calling for a new 28 days of lockdowns for what in Ontario they call red tier regions. Do you agree?
Yes, I do, Evan. I know the Premier has had a really difficult task balancing lives and livelihoods, but now is the time. I know the Ontario Hospital Association has called on all gray zones and all red zones to go into lockdown. Now, our lockdown is to be lifted or was to be lifted on December 21st, which is Monday. Now, I know the Premier hasn't made an announcement yet, but I bet he's looking pretty closely at this, and as well as the other surrounding regions. Our numbers have started to plateau, but I have to tell you, at 400 to 500 new cases every day in the region of Peel, they have not yet started to decline. And we've seen the same in Toronto, is actually hitting new peak levels in Toronto, and as you gave the numbers for Ontario as well. So what's the solution? Well, I think what the solution is we do take everyone into lockdown, including those red zones. The sooner we do this, the better. I know we had all hoped to be open for the Christmas, the holiday season, but that doesn't look likely because our cases are just not declining yet, Evan.
Do you think, look, he said today he's not making any snap decisions, Doug Ford, the Premier of Ontario. Do you think he's missing a window to get things back on track? Should he be moving quicker?
I think he's looking at the numbers, the case numbers very closely. And as you saw in the situation in York region, they waited until they had the hospital capacity was over capacity to pull the plug. You know, their case numbers were still manageable. And while they still had capacity in their hospitals, the medical officer of health felt comfortable saying their businesses should remain open. But once the hospital capacity was stressed, that was the time to close, go into the lockdown zone for both York and in Windsor. And I will tell you that the situation in my hospital, Trillium Health Partners, and as well William Osler in Brampton over in Peel, is dire. We have begun to cancel elective surgeries. They've been asked to open up capacity for 10 to 15% to accommodate additional COVID cases. We know that we're using about 150 rooms, not beds. Those are COVID cases that are in hospitalization, in ICU, or even, Evan, pending cases. Cases we're waiting for the results to be confirmed.
Yeah, just hearing you say that, things are dire. And I know there's a lot of vaccine hope, but the reality on the front lines in many regions is very different. You've also pointed out something called region hopping. In other words, if the lockdowns are very localized, you get something called region hopping, and that can be dangerous. What is that?
Well, I've been advocating for a GTHA lockdown, and some of the mayors on our weekly Monday calls that Mayor Tory puts together have been advocating for the same. We saw last week from the articles written in the local newspapers, the Toronto Star, they looked at aggregate cell phone data. And what they observed was that people in Toronto were going to Markham to do their shopping, people in Brampton over to Vaughan, and people in Mississauga were going to Milton, to Oakville, and to Burlington. So people continued to do the shopping. They were not staying at home as we had been advising them. We said, stay home, only go out for the essentials, but it's the holiday season, and they wanted to take that opportunity if their local retailers were closed to go into a region where they were open.
Okay, so you've called for this lockdown. The situation's dire. It seems to me that you've got to have a ticking clock on this, Bonnie Crombie. What is that ticking clock as we move ever closer to the break and Christmas?
So certainly the right thing to have done is to take us into lockdown sooner. I think that way there's a possibility we could have opened now for the holiday season. I think 28-day lockdown, I know that the Premier is looking at it. He's looking at those other regions, whether they're Durham, they're Halton, they're Hamilton, et cetera, perhaps to move them into lockdown. Perhaps that will get announced tomorrow for Monday when we were to come out of lockdown so that we can get this out of under control. I mean, that virus is controlling us. We're not controlling the virus. I think we get locked down across the entire region until things stabilize, until we get capacity in our hospitals again. So people that have necessary surgeries have been waiting months and months for their hip replacement, their knee replacement, to get treatment, can be afforded those surgeries, because right now they are canceling elective surgeries, and there's become a point very soon where they'll be transferring ambulances to other hospitals. They're already starting to transfer patients to other hospitals where there is capacity. I mean, that is our last line of defense, our hospitals. It's only one part of the equation to look at the case numbers, which are high and are not started to decline. Public health can no longer do contact tracing. And now we're told that the situation in the hospitals is dire, and they are canceling elective surgeries and transferring patients out. So this is the time to be looking at lockdown across the region.
So Bonnie Crombie, I really appreciate you outlining this. And folks, that message, I don't know how much more urgent you can make it. This is it. We're down to the last line of defense before things get overwhelmed. Mayor Crombie will be watching this closely. Thank you so much.
Thanks for the opportunity, Evan.